community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit HSA.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendinitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to Healthcare Today with the HSA. Each and every Friday and Saturday at 1 p.m. we get together and talk about all things related to your health. And at this time, I want to say congratulations to the HSA. I have with me, you know what, ladies? Go ahead and introduce yourselves. And let's give a little bit of your accolades because I want to just highlight that because the team has done a tremendous job. And this is just a prelude to it. So go ahead and introduce yourselves.
Good morning. My name is Sarah Caswell. I'm one of the Pediatric Occupational Therapists at the HSA. We are very excited and honored. We have won gold for occupational therapy for the second year in a row now.
And I'm Faith Rochez. I am the team lead for Speech and Occupational Therapy, representing the Therapy Services Department. And so this is the second year that speech therapy has won an award. Last year we got silver in Best in Cayman. This year we've gotten gold. And our physiotherapy department also got gold. So our entire department swept Best of Cayman gold awards this year. So we are just over the moon excited and just so thrilled that the community has that much faith and confidence and love for our department and all the hard work that we do for our community.
I love that. I love that. You know, the recognition comes because you do a good job.
Yes.
And going beyond that is exceptional. I think one of the things that people don't realize is the amount of effort that you put in. People just take it for granted that you have the ability to talk, you have the ability to communicate, to speech. They don't realize the time and effort it takes getting people who are not that capable to train your body to do these things again or to do it for the first time. You know, it just, you know, taking a look at it, because I've had, you know, quite a few conversations with y'all ladies over the years, and I just see how important it is. You know, people coming with stuttering issues feeding issues, different things of that, and see the effort and the time that you take to put into getting them to even a normal understanding and a normal body attribute is tremendous. So kudos to you and your team for doing that. So
Thank you.
The recognition, I want to say, so tell us a little bit about the specific services that therapy has on both sides. I know we do occupational therapy, you do speech and language, but then we also want to talk a little bit about physiotherapy.
Yes.
And go a little bit into details about that.
Sure. So in our occupational therapy department, we say we do from birth to 99, but obviously it does go older than that. So occupational therapy intervention can start as early as birth in the neonatal intensive care unit. So if you have a baby who is born prematurely, you can be at risk for some developmental delays along the way. So we like to get in there in the beginning, do some assessments, get to know the family, kind of introduce what we do. And then for that pathway, we will monitor premature babies up until they're 2 years of age. We offer a variety of services at HSA, and I think that's probably part of the reason we are so successful. My area of specialty is typically working with children who are still working on achieving those motor milestones. So whether it might be crawling or walking, we also offer a specialty type of intervention called dynamic movement intervention. HSA is the only occupational therapy service on island that offers level B, it's called, for DMI. Then you start to kind of move into your 5-year-old range. Sometimes those kids need some assistance with what we call pre-academic skills. So things like learning to print, learning to cut, or challenges with attention and regulation. Sometimes that can be a big thing. Maybe your child has the physical abilities to be ready for school, but from a sensory processing standpoint or an emotional regulation standpoint, they need some assistance. And that goes all the way kind of in through high school. Then you transition to adults. Typically with adults, occupational therapy is involved for regaining skills. Typically there's been some type of trauma or event that's happened, and maybe we need to learn how to do things again, or maybe learn how to do things differently. One of the things that the occupational therapists at HSA lead for the Cayman Islands is the prescription of complex equipment. So if you have any type of positioning needs outside of your standard transport wheelchair, we've partnered with a vendor from overseas in Florida, and they come down and we will prescribe specialist wheelchairs. The amazing thing about those specialist wheelchairs is people gain a lot of independence. The impact we can have with that population is absolutely incredible.
I think when you think about it, movement always is a positive thing. And to think of a child not being able to have full mobility and then be able to move and just it's just a joy to see. And also to know that we have those services on island, that you don't have to travel overseas, which, people, I tell people, said traveling with medical issues is never ideal. It is as much as you think, us having these services available in-house on island is faster, more economical, and also the support that you get here is literally, as I say, right down the street. If you have an issue, you need some sort of assistant, you can make a phone call and you can reach one of your people in the department. It's that simple and that easy. Exactly. So doing the switch, we talked about improving the lives of patients. Apart from that, Ms. Faith, as I would say, one of the most recognizable figures in our community has to be the fact of when you go out and you see a child doing for themselves, being able to kind of assimilate back into the community, being able to talk, being able to have momentum, movement. Is that the service that sets you apart?
I think what really sets us apart is the fact that we use evidence-based, multidisciplinary, culturally responsive care. So we're using many different evidence-based prongs in order to provide the best care possible for each and every patient that walks through the door. We provide services from birth through end of life. And so I think because of the wide range of services that our team provides, where we're providing inpatient services, outpatient services, community-based services, across so many different complex areas, to be honest, and we're able to look at it, from a clinical lens, from a medical lens, from an academic lens, from a quality of life lens. And so I think because there's so many facets to the service that we provide, and the service that we provide is so wraparound, I think that is what really sets us apart, is that regardless of the stage of life that you're in, and regardless of where you need your needs are, we're able to meet your needs in that area. So I think that is what really truly sets us apart.
Do you think that's the reason why in the department that I'm talking about is speech therapy? Speech therapy is really a wide range of different, so we've had conversations, and some of the issues and conditions I had never even heard of. But it's such a wide base part of being, I say, the medical field. Tell us a little bit about the diversity of patients that you encounter.
So, like I said, we see from birth through end of life. And so we might be asked to see a baby in the NICU, not as often as I think the PT and the OT team do. But if there's an issue with feeding at birth, maybe that baby is really struggling with latching on the breast or latching on the bottle and feeding orally, that is where speech will come in. If there's a craniofacial or some type of physiological structural issue, maybe we just need to be a part of the team to monitor as that baby gets older. So let's say there's a cleft palate, or let's say there's a tracheostomy tube, which is a breathing tube in the throat. Then as that baby grows and things like speech start to come into play, that's where we're going to want to try to jump in.
Slurs and things of that nature, swallowing.
Right, exactly. So we're just going to want to make sure that we're keeping tabs on that child's development and making sure that we're able to provide that early intervention. As we get into just regular developmental delays or neurodevelopmental delays, things like neurodiversity, articulation deficits, just sort of those kind of things that I think speech therapy is most recognized for. That kind of comes into play as children get older into school age. But then as you start to deal with kids like in high school, or you start to deal with adults, you're looking more at things like executive functioning and my problem solving ability and the sort of the cognitive aspect of it. And similar to OT, in all of our therapeutic fields, with adults, our focus on adults is regaining. So with peds, it's habilitation. We're teaching you skills that you need to have, but you never had them before. For adults, we're focusing on rehabilitation. You were able to talk, you were able to walk, you were able to eat, you were able to swallow, you were able to problem solve. Now you're not able to do those things.
And this can be due to a variety of
things. It could be cancer, it could be an adverse reaction to some type of surgical procedure, it could be a stroke, it could be a car accident, a brain injury, it could be a neurodegenerative disorder, it could be any number of things. And so that's where we come into play to try to help you regain and strengthen those areas that you need additional support in. And then through end of life, when we're looking more into the hospice, again, the focus is more on just kind of communication and feeding for end of life care. Are you able to communicate your basic wants and needs? Like, what can we do to help make your transition from this world a peaceful one where your quality of life is not being compromised?
Right. And I think some of the items that you hit in the latter part, we understand the training when you don't have it. But knowing and understanding how to communicate, not being able to, there's a lot of frustration there. There's a lot of anger. There's a lot of stuff happening that is underlying to the effect of not being able to communicate.
Yes.
And those, I think, the measure of success in speech therapy, small but significant.
Right. Yeah. And meeting the patient where they're at, right? Because you have to take into consideration for your adults, like, okay, maybe this person wasn't someone who was literate before they had their stroke. Okay. So writing or something that's very like word based may not be what's best for this person. Maybe something that's more picture based might be best for this person, right? Or maybe this person was not super big on technology, before, and they're not interested in a speech generating device. And so I think a lot of times people will look at a patient and say, oh, you had a stroke and the speech is not coming online, so let's just give you a device, or let's do.
And you just tap it and write it or whatever.
Right. And it's like, but, we also have to factor in, like, what is this patient comfortable with, and what, where were they baseline, and what's their skill level like, and what were they, were they literate? Is this something that you are actually interested in? And I'll show it to you as an option, but really we want that patient-driven model where, okay, we're meeting you where you're at so that you are comfortable and you have bought into the therapy process as well. And
I think those are probably, for me, like we consider our generation very tech driven. We grew up with cell phones, and you do all of this stuff, and yet the older generation that probably needs it I may be wrong, but needs it most are not that tech driven
and not interested.
Right.
Yes.
They're not like, I'm not going to be getting the newest iPhone. No, I want something that I can call, but I don't need to be on the internet 24/7. Right. So there's a big difference. And how do the department deal with that tech-wise? So
what we do is we just present a variety of different options. So we brainstorm with the patient and we say, hey, okay, so you weren't literate before. The word-based thing, that's not an option. Here's some picture-based. We could do a book. We could do pictures. We could have stuff stuck around the house. I'll show you the iPad. I'll show you could put it on your phone. I'll show you this as an option. Try it. If you don't like it, no problem. Like, let's do what works for you, right. And so it's very individualized, all of the care that we provide to all of our patients.
I think that's a great. We're going to take a break in a few minutes, but I wanted to just say this. We have such a vast array of personalities and skill sets with our community. I use my mom as an example. This is a woman that hated technology, and because of her grandkids, she's online with me. She's perfected it to. She's learned that, and I'm like, I don't know that. I haven't gotten to that level, but she's taking classes. She's all into it 100%. And I'm thinking, on the flip side, I have a cousin who the worst thing is an iPhone. They said, oh, can you get me one of the dumb phones? And I'm like, what's that? Oh, that's just a phone that I have that doesn't go on the internet.
Like a talk and text.
Yeah. And I'm like, they have those. They say that's for like people like me. And I'm like, okay. So there's a vast array of different levels to this. And you in the department has to take a look at all of these.
Yes, yeah, definitely. So, and that's just part of the individualized care that we provide, kind of just meeting patients where they're at in terms of what their baseline was and their clinical presentation now.
So we're going to take a first break right now. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and I talk about all things related to our health compliments of our friends over there at the HSA. And we're talking with the award-winning therapy service team over at the HSA. They've been recently recognized as the best on the island, taking home gold in their respective categories: occupational therapy, speech and language therapy, and also physiotherapy for the Best in Cayman Awards. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together at 1 p.m. and talk about all things related to your health. And at this time, we are throwing accolades at the wonderful therapy service team over at the HSA. They've been recognized as the best on the island, taking home the gold in their respective categories of occupational therapy, speech and language therapy, and also physiotherapy for the Best of Cayman Awards. And so before we left, we were talking to Ms. Faith about the services and also what sets them apart. And with that saying, I want to ask her, what were some of the big challenges you face, because the island has continued to grow.
Yes, and at a very fast rate.
Very fast.
Very fast rate. And so I would say our biggest challenges has been kind of just keeping up with the demand because, one, the population is growing at a much faster rate than anticipated. So people will notice now that HSA as a whole kind of seems to start to be spread out, almost like how when you go to Baptist and, you have one building on one street and one building on another street. So they'll know we're at main campus, we have Smith Road. But our department is at Baytown House, so we're starting to be spread out because we just don't have the physical space in order to keep up with the demand of the population, right? And also, as an authority where we're heavily regulated, we can't just say, oh, we have a wait list, let's just turn around and hire somebody tomorrow. Like, there is a process that we have to go through, an extensive process to kind of justify the need for additional staffing and that sort of thing. So I would say our biggest challenges have been in terms of just having a physical space that's big enough to accommodate, like, the patients and all of the therapists, as well as just growing our team. And so, but we have grown quite a bit over the past few years. I mean, I remember coming up even on my 10-year anniversary being the only speech therapist, and before the end of the year we're expected to have 5 speech therapists in our staffing complement. We had no OT when I first started to work at HSA. I'm dating myself a bit now, but when I first came back home and started working in the therapy services department, I made 7 members of the department. So we had 6 physios and myself, a speech. And so just to see how we've now grown to, I think, almost 30 now, where we have 5 OTs, we're about to have 5 speech, and, 20 physios about that much.
That's kudos to the team for recognizing how fast in recent years the community has grown.
Yes.
I mean, this is, we always laugh at the growth of the world population, but think of it as a small island, how much we have grown, and also, and I hate to say it this way, but problems have come up. So you had to say, okay, you know what? Do I anticipate problems in the future?
Yeah.
Sure. So how do I combat that? I need to have specifics for this. I need to have equipment for this. I need to have space for this.
And I want to highlight that, in the past as well, we often relied on sending patients overseas for certain areas of expertise, right? And as the medical community in Cayman has grown, what we see is a drastic reduction in the amount of patients that need to go overseas. And so we haven't just grown in personnel, but we've also grown in experience and training, where we look at what the trends are. So, for example, Sarah mentioned she has done DMI.
Sorry, what does that mean?
It's dynamic movement intervention. It's something that's kind of gained quite a lot of popularity in the therapy world right now, and there's a lot of research going on to show the effectiveness of it. But basically, it is an intense form of therapy that uses a patient's postural responses to movement to further develop their skills. And it's also something that you work on the patient's highest level of skill. So a difference from therapy in the sense that it's, okay, you're a child, you're 16 months, you should be walking, but you're not able to stand independently. We're still going to work on walking. We're going to do it in a certain way where we're targeting those skills. And I'm very excited for more research to come out on it, because the progress I have seen here on the island is absolutely amazing with some of my kids. The occupational therapist in me loves it because it also incorporates a lot of sensory experiences. So we talk about vestibular input. That's movement. If you think about being on a swing, that's movement that's giving you vestibular input. Proprioception, it's kind of that feedback your body gets from your muscles and your joints. If you're delayed in walking, you're not getting the same sensory experiences as your peers of that age, because you're not independently moving through space. So that can also cause potential challenges with sensory processing. So this type of therapy it kind of incorporates all of it. It's amazing. They're doing a great job of trying to getting it out there. And so then we've also been successful in piloting something we call intensive therapy blocks. So right now there are some children on island who will, say, travel to Canada for 2 weeks to do therapy every day, Monday to Friday, for 2 weeks. We are working on introducing that here. So actually last week, I spent an entire week seeing the same kids every single day for a week. So it was a bit of a shorter block of intensive therapy, but our goal is to build it up to 2 weeks. But it's that demand. I can't just cancel all my patients for 2 weeks and do that block of therapy. So we're working on it, but it's something that's newer within the last few years to the Cayman Islands. There's a physiotherapist that offers it. There's myself and someone else, and it's something we're really focusing on growing at HSA.
And I just want to, when you start talking about that, the teamwork for the client. You talked about, reaching out to other kind of people in the industry. How closely do you work with others in the industry?
Very closely. I think one of our ultimate overarching goals is patient-centered care. And that's not only the patient, that is the family. So, for example, a therapist, we think it a lot. We always say, I wish I had another pair of hands. Because to do something safely with a child, you always have to make sure they're safe. So you want to be doing, say it's DMI, higher level balance stuff, you need someone there. And it can't always be the family, because you need someone there that understands what you're going to do and anticipate what could happen. So I do work very closely with physiotherapy, especially for the under 2 population, because you've got a lot of motor development happening with neuroplasticity, especially if you think about your children with cerebral palsy. Children with cerebral palsy acquire 90% of their motor skills before the age of 5. So we work very close with physio, doing lots of programs. We also work very closely with our speech and language therapy colleagues for a variety of reasons. One that comes to mind the most is that family-centered care. if you have a child who has been maybe say going through some investigations because we're not quite sure why we're seeing this global developmental delay, and all of a sudden as a parent you went from having no therapy to therapy 3 days a week because they need to see physio, they need to see OT, they need to see speech. And if you're working, that's hard. How are you supposed to miss work 3 times a week and get them there and do things? So we try where it's appropriate and in the best interest of the child to co-treat. So I do quite a few sessions where I co-treat with my speech and language therapist. So now mom's only coming to the clinic once and she's seeing 2 therapists.
Right.
It also is great for what we call modeling. So when I'm working with my speech therapy colleague, I can see the strategies she's using to try to increase language. So if, say, she's on leave or I'm seeing the child by myself, I can still use those similar strategies even with the therapist out being there, and vice versa. They see that I'm working on sitting balance, so they can try to support the child in sitting while doing
they're
language.
working on their side of it.
So collaboration is amazing. I don't think we could be as successful as we are without it. And there's lots of room for it. There are some instances where it's not appropriate, and we will have those conversations with families, because if I'm going to work really hard on some physical skills, if you need to think about going to the gym, if you're working really hard at the gym and you're out of breath, you can't talk. You're working on physically what you're doing. That's all kind of the cognitive load your body can handle. So sometimes we say to parents, unfortunately, it's not in the best interest of the child. They need a sole language session because the OT session is maxing out their cognitive load.
Right. They're pushing them on that side, and they're not able to compensate for the other part.
Exactly.
So sometimes what we'll do then is, if it's an issue where like getting into the clinic is hard for the family, then we'll try to do sessions kind of back to back based on like, okay, we might say they're too tired after OT, so let's speech see them first. Or if this is a child who maybe struggles with like regulation, maybe after their OT session, they're a bit more like settled, more calm, they're more ready to engage and to learn. And so then they would do speech right after. And, you know, just continuing on in terms of the training, like we do have our, one of our Caymanian physiotherapists, Mariah McIntyre, who has just wrapped up doing an advanced degree in pediatrics, who is coming back and joining our team in the next couple of weeks. So we are super excited. So that's just kind of on that thread of all the additional trainings that we've done. We see less need to refer neuro patients overseas for neuro rehab. So we have a complete neuro team that provides that neuro input from inpatient and follows them out either into the community or into the clinic. And that is, again, all 3 areas. And then from a physiotherapy standpoint, we've seen, you know, increases in, for example, lymphedema and oncology, where we're providing support for patients like post-cancer or patients who struggle with lymphatic drainage and that sort of thing, where you might notice that they're having that swelling of their hands or swelling of the feet.
Right.
The lymphedema therapy uses certain massage protocols as well as like compression protocols. And so we work very closely with patients to manage that. We have women's health physio, which has become a huge thing recently in terms of strengthening the pelvic floor, because as women, you know, I'm a mom, you know, after you have a child, you know, things don't always work the way that they should. And I think for generations, women have just thought that they just need to live with it. But we now know, like, no, you can do, you know, women's health physio. I know I utilized the service at HSA during my recent pregnancy, and like just in terms of like some of the postpartum issues that I had with my daughter, I have not seen with this, even though I'm, you know, significantly older. So it definitely works. And so I just think like, and then just even in terms of, we've talked about, you know, some of the specialty areas that the team has expanded, you know, training in, but we also have expanded training in modalities, right? So the team, the physio team knows how to do dry needling, they know how to do acupuncture, they know how to do kinesiotaping, they know how to do cupping.
It's very comprehensive.
Very.
Is kind of the overall. You're going to one specific place and you're having everything that you need in that one place as best as they can provide it.
Yes. Yes, absolutely. And I think because we're so good at what we do, sometimes how our approach to patient care looks different, because we really push a lot of patient education and patient involvement and patient responsibility. So, we're not the type of multidisciplinary clinic that is like, oh, just come and, we're going to massage you and relax and okay. And, we'll continue doing this for 3 years. No, we're like, listen, this is what your injury is. This is what you need to do. This is how we're going to get you back to your regular scheduled life as soon as possible. And that is sort of our approach,
When you bring up the idea of physical injury, I want to kind of slide into the physiotherapy part of it. I mean, over the years, physiotherapy has become almost, I want to say, a daily occurrence. Before people said, I'll just live with the pain. I've hurt myself at the gym. I've hurt myself playing, whatever, injury. I'll just take 2 pills and I'll be fine next week. And 3 months later, it's still there. 6 months later, then they're walking slower. A year later, they can hardly move. So how do you see the broader role of physiotherapy in preventive care?
I think just in terms of preventative care, I think like physiotherapy can help you to be more aware of your body movements and what are the appropriate movements of your body. Because I think so much we get used to moving our body inappropriately and we think that is normal. And what that does is actually set us up to be more at risk for injury when we're doing our activities of daily living. So in terms of preventative care, I think physiotherapists are great at identifying what's appropriate posture, what are some like ways that you should be mindful of, like how are you sitting at your desk at work, or like when you're doing pickleball or when you're doing at the gym, what's the best way for you to engage in that activity to minimize strain and minimize injury to yourself. And I think that is where the preventative part of physiotherapy comes in, is just helping you to be aware of the mechanics and the dynamics of your body and how to make sure that you're using it appropriately and effectively so that you're minimizing your risk for injury or recurring trauma to that joint or that area later on down the road. And so by engaging in that good practice, what we do is we help to utilize our joints and have that movement and that range of movement for a longer time possible. Because we're living longer now as well, what we see is on the flip side is that physiotherapy can help you go back to those activities of daily living and sort of help you learn how to continue to do those activities safely based on your current clinical presentation. And we'll target those exercises for that purpose, right? So if, say, my thing is I like to be in the yard gardening, but that is a lot of strain on my lower back because I'm having to bend down a lot, your physiotherapist may tailor their exercises and their treatments and their modalities to help reduce the inflammation in that area, to help increase your range of motion in that area so that you can continue to do that activity that you love in a safe way.
And I think that is really what it's all about as far as health maintenance, because we are living longer. We are doing things. People are working in their jobs longer, not just because they have to, but because they want to.
Yes.
So with that, how do you protect yourself from an earlier stage so that you're able to bend down and not strain your back?
Yes.
How to bend, people laugh, say, oh, pick up from your knees. And I remember that so clearly. And it was one of the biggest things that, you learn, pick up from the knees. Okay, why? Till your back gets thrown out.
Yeah.
And then you realize that, wow, okay. And then it's almost a downhill because once it's strained, it continues to be unless you really take a hard look at it
Yes.
and give it time to prepare and heal.
Yeah, and passive modalities are helpful at healing, things like the ultrasound and the laser and the massage. Those do feel really good in the moment, but it's really important to pair those modalities with physical activity, because at the end of the day, if it is a musculoskeletal issue, we need to strengthen those muscles so that they can do what they're meant to do.
Okay, excellent. Folks, we're going to take our second break and come back. We're going to give them a little wrap up and show them some love here. If you're just tuning in, this is Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together at 1 p.m. and talk about all things related to your health. And we are talking about the award-winning therapy service team over at the HSA. They've recently been recognized as the best on island for taking the gold in their respective categories of occupational therapy, speech and language therapy, and also physiotherapy for the Best of Cayman Award. So we'll be right back in just 2 minutes. Keep it right here.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's Cardiology Clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. And as we start wrapping up here, if you're just tuning in, thank you for that. Talking to the therapy service team over at the HSA about their taking home the gold in their respective categories of occupational therapy, speech and language therapy, and also physiotherapy of the Best of Cayman Awards. And once again, before we get out of here, introduce yourselves, ladies, to my listening public.
My name's Sarah Caswell. I'm one of the pediatric occupational therapists at HSA.
And I'm Faith Rochez. I am the team lead for speech and occupational therapy. I am a speech and language therapist by profession.
So as we move forward, we've talked about the growing community, and we've talked about the growing department, but there's a little bit more behind it. So tell me a little bit more of what's going on with the team right now.
So currently, in addition to I mentioned that we have some additional staff that will be joining us between now and the end of the year. So we have a couple of new physiotherapists who joined the team, and expecting to have a full staffing complement by December. We also are in the process of renovating, so please excuse our dust and please excuse us during these next couple of months as we are in the renovation stages, to just update our facility so that we can continue to serve the community that we love so much.
Exactly. So new equipment, new spacing. And I'm always, I tell people I'm the techie guy. I love to hear the ramifications behind it, but also the community is what you're portraying. You're really going back to the grassroots of you're here for the people, you're here for the community, and this is what it entails.
Yes, and mainly the purpose of the outfitting is just to provide more like clinical spaces for our team so that we can continue to provide that outpatient care, as that's where the biggest demand is right now. But we also are, expanding other services. So we have more therapists out in the community. We have occupational therapists who are out in the community almost daily. Somebody from the team is out in the community. We have members of our team, the physio department, who are on the wards providing inpatients every day, all day. We have members of the occupational therapy team who go every morning, provide support for any patients who are inpatient. Our speech therapy team goes 3 times a week, and we'll be increasing that to 5 times a week. So what we're doing is expanding in terms of what we're offering inpatients, but we're also expanding what we're offering in the community, because we recognize that as our population is aging, and as we're getting more sort of patients who have these complex medical diagnoses, that physically coming out to the clinic may be difficult because they may be bedbound or they may be medically fragile. So we're coming out to those patients, and then everyone else, we're able to accommodate and facilitate them in the clinic for their outpatient therapy.
I think that's really great. The idea of patient services has expanded over the years, and also include, before it was like, it was a rarity for people to go visit you in your home. Now it's almost a weekly norm to make sure you check on them, make sure they're doing well. And that's just part of the personalized service that you guys do over at HSA.
Yes, yeah, absolutely.
Definitely. And just wrapping up, I know I've said this before, and I just want to congratulate you and the team, both of you ladies and the team, for your constant, vigilant services to the community. As we say, we leaps and bounds, but you guys are really the forerunners for all that we expect from a team. People have traveled, as I said, traveled to the US, they've gone to London, they've gone over the globe. But realistically, the best care is right here in our own backyard.
And people are moving to Cayman to access services. Like, that is a huge selling point when people are moving to the island. And we're seeing an increase in families who have chosen to come to Cayman because of therapy provision, because of ease of access, and so we're super fortunate. I've said it before on the show, but we are so fortunate to have the amount of services, expertise, specialty areas. I mean, when I go away to a conference and I tell people what we do and our populations, people are blown away by the breadth and depth of the medical services that we offer at HSA.
I will tell you, I've had the ability to travel quite a bit, and for a town this size, the whole island, just think of it as a town that size, they barely have a clinic.
Yeah.
And when I say clinic, not even a surgical ward, that they have to go 3 or 4 hours to somewhere else.
Yes.
And we have that within our, and just not only clinic, but the therapy services, the maternity, all of that stuff is available right here on this island.
Absolutely.
And that is by far a blessing. I tell people, they're like, they can't imagine for this place to have that and I say first world because that's what we consider it, but first world tier understanding of medical facilities right here in the Cayman Islands. So kudos to the HSA and your team. So before we wrap up, if someone wanted to reach out to you, how can they do that?
So they can contact the department. They can call through the main line, 949-8600 or 244-2592, 244-2593, or 244-2594. Alternatively, you can send us an email for speech therapy at hsa.ky, for occupational therapy at hsa.ky. For physiotherapy, just email, I would say, the manager, Rockella.Smith, ROCKELLA.Smith at hsa.ky, and we'll direct you accordingly.
Sounds good. Thank you, ladies, once again, for doing what you do. Thank you so much, ladies, for stopping by here today.
Thank you for having us.
Yeah, thank you.
Keep it right here as we continue on. We'll be back next week right here on Healthcare Today with the HSA.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's Cardiology Clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.